My name is Dr Sarah Tansley and I'm a consultant rheumatologist. This video will cover what do I need to know before I sign up for my clinical data being used for research studies. In addition to clinical work at the hospital, I also undertake research at the University of Bath and support research studies here at the hospital. Clinical research is vital to help us understand how people can be affected by their disease and how we can best treat them. There are many different types of research and many ways you can get involved. We know that research-active hospitals deliver better patient care, and here in Bath we aim to provide lots of different opportunities for our patients to participate in research. Participating in a research study nearly always involves providing information about you and your condition, sometimes alongside extra tests. There are very strict laws around how we use and look after your information. We're obliged to keep your data secure and wherever possible anonymised so that you cannot be identified. Some research studies use routinely collected clinical data. That's the information collected not for research purposes, but as part of looking after you and monitoring your condition. Examples might be routine blood tests or disease activity measures. As well as helping look after you, this data can also be used to help us understand how well we're meeting standards of care and where we could do better. For example, it could be used to see how quickly patients are diagnosed and start a treatment. This then helps us plan and improve our service. When this data is anonymised so that you cannot be identified, it can also be used for research purposes. Routinely collected data is really valuable for research, as other types of study often have strict eligibility criteria, so don't include everyone. Research using routine data helps us understand what happens to all patients and in the real world. It might help answer questions like, how many patients with a particular condition are disabled, or how many patients get better after receiving a particular treatment. It could also show which patients are more likely to respond to a treatment, and that can then in turn influence what treatments patients might be offered in the future. If you don't want your data to be used in this way, you can opt out on the NHS website. Before you take part in other types of research study, you will need to give your consent. This means you'll be given detailed information about the study by the research team. You'll have an opportunity to ask questions, and if you want to take part, you'll need to sign a consent form. You can always change your mind about participating in a study, and choosing not to participate or changing your mind would never affect the care that you receive. Occasionally, your doctor or another member of the team might ask if you would consider participating in a study we are running, if they think you could be eligible. If you don't want to, that's always okay, and you don't have to give a reason. There are different types of study which collect different types of data and involve different levels of commitment from you. Some studies take a really simple snapshot and just involve a single appointment to collect data and maybe blood or other samples at the same time. Other studies might involve multiple visits and potentially taking a new or a different medicine. At any one time, there are several different studies open in the department, and if you want to know more, you can ask your doctor or nurse at your appointment. You can also contact the Rheumatology research team directly. Thank you very much for your attention.